The next topic for infertility module is male fertility. It's a small but relevant presentation where I am going to tell about the causes and evaluation of the male infertility. So this is also based on Speroff and ASRM AUA guidelines. So there is a rise in the male infertility, that's because of so many factors. As you see in the picture, it could be because of some sexual dysfunction, ejaculation incapacity, hormonal dysfunction, genetic causes, sexually transmitted diseases and so many other things. Male infertility is the sole cause in 20% causing infertility and contributing factor along with the female infertility in 20 to 40% of the couples. Like many times we see both male and female infertility in the same couple undergoing evaluation. Now, how the regulation of the function of the testis happens. So, I am going to take just as based on the headings present in Speroff. So, we will go first with the endocrinology, then evaluation, then we will see the investigations. Now, this is the cut section of the seminiferous tubule. So, you can see the lumen nicely, it's present here, and with the spermatids. This is the Sertoli cells, this is the basal lamina, and this is the Leydig cells. So, Sertoli cells, the seminiferous tubules contains the Sertoli cells and the spermatogonia. So, S, easy to remember. So, forms a diffusion barrier, Sertoli cells, and this is also called as the blood testis barriers because it protects the sperms from toxins and infection. The other area where this barrier is blood-brain barrier. So, Sertoli cell, the testis and the brain, they only have this barrier, okay. So, this acts as a protection, the Sertoli cells, and it provides nourishment to the spermatogonia which are found around them, okay, simple. Then, outside lies the Leydig cells, right, and this secretes the testosterone. So, testosterone goes through the basal lamina, through the Sertoli cells, they also have some testosterone androgen receptor, goes and gives the nourishment to the growing spermatogonia and they will form into mature sperms. So, the spermatogenesis is again important. So, how it happens is spermatogonium is diploid, then they become the primary spermatocyte. In meiosis 1, they become the secondary spermatocyte, and in meiosis 2, they becomes the spermatid, and thereafter they become sperm. So, from which stage this is haploid is after they undergo meiosis 1, from the primary spermatocyte to secondary spermatocyte, they become haploid and thereafter they are haploid, okay. So, it is in initial 2 stages they are diploid. Spermatogenic process is because of the genes present on the Y chromosome and it takes 70 days to complete from the spermatocyte stage. Another 12 to 21 days are required for the transport of sperms from the testis through the epididymis to the ejaculatory duct. Okay. So, the result of the semen analysis, say for example, a person is giving a semen analysis today, it is because of the semen which was produced 12 to 21 days which has been transported slowly over time into the ejaculatory duct. And the final maturation or the capacitation happens in the female genital tract. Okay. So, the life cycle is actually 70 days. So, if one person has to repeat the semen analysis, you should give them at least 2 to 2.5 months.